Just to make some announcements, we have standing in for Representative Carlin, Representative Stogsdill, so welcome to committee. And then also standing in for Representative Rajas, we have Representative Howerton, so welcome to committee. Committee members, you should have received copies of the information regarding higher education for the Promise Act and the historical tuition data and fee increases, so you should have those at your place settings, or you should have received them through email. Committee, you should have received also through email the minutes for the February 17th meeting. Were there any changes to those minutes? Seeing none, Representative Johnson.
Mr. Chair, I move the minutes be approved as distributed.
All right, committee, you've heard the motion to approve the minutes for the meeting that we had on February 17th. Is there a second? Second by Representative Sutton. All those in favor of approving the minutes say aye. Aye. Opposed? Motion passes. Committee, are there any bill introductions this morning? Seeing none, we'll go ahead and move on to Chairman Carpenter, the chair of the Social Services Budget Committee. He'll be doing his budget recommendations from his budget committee, and so please indicate, Chairman Carpenter, which budget you're going to be starting with this morning.
We'll start with the Department of Children and Families. Okay. Good morning, committee. That starts on page volume 2, 1051. Committee, good morning. Buckle up. The Department of Children and Families is a cabinet-level agency headed by a secretary appointed by the governor. The mission of the agency is to protect children, promote healthy families, and encourage personal responsibility. The Department of Children and Family operates 7 programs: administration, child support services, economic and employment services, rehabilitation services, prevention and protection services, Developmental Disabilities Council, and the client service delivery. The agency requests in 2022 $1.1 billion, including $365.4 million SGF. This is an all-funds increase of $335.1 million, or 42.4% above the amount approved by the 2021 legislature. This increase is largely attributable to increased federal funding made available during the COVID-19 pandemic for assistance programs such as temporary assistance for needy families, pandemic funds, the low-income energy assistance program, and the low-income water assistance program, and funding for child care providers. This is an SGF decrease of $500,000 or 1% or 1.1% below the agency's approved amount. This is primarily attributable to the decrease in the public employees' retirement system, employers' contribution rate, and monies inadvertently apportioned to the Hope Ranch pilot program twice during the 2021 legislative budget process. The SGF decrease is partially offset by the increase in unemployment insurance contributions for 2022. The 22 revised estimate includes 2657.9 FTEs, which is an increase of 108 FTEs above the approved amount. This increase is primarily due to several pandemic-funded positions that will be deleted once the pandemic funds are expended. The governor's recommendation for 2022 expenditures is $1.1 billion, including $348.1 million SGF. This is an all-funds decrease of $18.4 million, or 1.6%, below the agency's 2022 revised estimate for human services caseloads estimates. The governor recommendation also includes an SGF decrease of $17 million, or 7.4% below the agency's 2022 requests. In October of 2021, the Human Services Consensus Caseload estimates for 2022 were decreased by 1.1 million or 1.9 million federal funds for TANF cash assistance, and a decrease of 16.5 million, including 17 million SGF for foster care below the prior estimates. The decrease is in TANF cash assistance estimates is primarily attributable to the availability of federal COVID-19 stimulus funds. The increase in the foster care program, or the decrease in foster care program, is primarily attributable to a $10 million in reappropriated funds SGF funds from 2021, as well as maintaining case management provider rates at the 2021 level as adopted from the previous reduced resource options presented to the 2021 legislature. While the projected number of children in the program is slightly lower than the spring estimate, there's a slight increase of projected average cost per child. The governor also recommends 2657.9 FTE positions, which is the same number as the agency's 2022 request. The Budget Committee concurred with the governor's recommendation. I'll stand for questions on 2022.
All right, thank you, Chairman Carpenter. I want to go back to this amount of $18.9 million that was unspent as far as state general fund money in fiscal year 2022. Could you elaborate on that? Was that unspent due to the fact that they received federal money, or was it just because we appropriated funds that we necessarily didn't need to?
It was that we had funds in there that we didn't need to appropriate.
So they're carrying this over into fiscal year
2023.
All right.
Which is common with caseloads. You know, we project those in advance. November's caseloads, you know, twice a year. And so it's common for those caseloads. And many of you have heard me rail about how unpredictable our caseloads are when you're talking about trying to predict 6 months in advance, you know, of what the needs are going to be. So it's not uncommon. I think in some of the other agencies have like $40 million worth of reappropriated funds.
All right, thank you, Chairman Carpenter. Any other questions for fiscal year 2022? Seeing none, move on to 2023.
The agency requests 2023 expenditures of $979.3 million, including $371 million SGF. This is an all funds decrease of $145.4 million, or 12.9% below the 22 revised estimates. This decrease is largely attributable to federal COVID-19 relief funds that are no longer available in 2023. This decrease is partially offset by 11 enhancement requests totaling $23.5 million, including $15.6 million SGF. This is an SGF increase of $6 million, or 1.6% above the agency's 2023 request. This increase is primarily attributable to the agency's 11 enhancement requests. And for those, you can look at page 1159. The governor recommends 2023 expenditures of $972.5 million, including $367.3 million SGF. This is an all funds decrease of $6.7 million, or 0.7% below the agency's FYI 23 request. This decrease is primarily attributable to adopting the Human Services Caseloads Fall 2021 estimate and not recommending all agencies' enhancement requests. In October of 2021, the Human Services Caseloads estimates for 2023 was a decrease of $2.3 million federal funds for TANF cash assistance and an increase of $500,000, including $1 million from SGF for foster care from the prior estimate. This increase in foster care is due to the anticipated fluctuation in contract expenditures based on changing acuity and service needs for children in care. This increase also includes replacing $3.3 million from special revenue funds for a one-time reduction as part of the governor's reduced resources budget for 2022. The governor funds $18.6 million, including $10.9 million SGF from the agency's enhancement. The governor recommends 4 of the agency's 11 enhancements requests in full. These enhancements include protection specialist salary increases, $3.7 million, Kansas Management Information System replacement, $3.5 million, Amazon Connect Virtual Call Center, $1.9 million, Families First Prevention Services Program increase, $7 million. In addition, the governor recommends partial acceptance of the 3 additional enhancement requests. These enhancements include Families First Prevention Services SGF only grants, $1.4 million, Independent living subsidy for foster care use, $750,000, and capital improvements of $450,000. The Budget Committee concurs with the Governor's budget with the following adjustments. Add $5 million all SGF for workforce recruitment and retention for the child placing agencies and licensed facilities, including qualified residential treatment program for 2023. Add language to lap this SGF funding if the request submitted to the Sparks Advisory Panel for COVID-19 funds by the Children's Alliance of Kansas is approved. Add $500,000 all SGF for Safe Families of Kansas for the purpose of expanding the program in Kansas City and Wichita metro areas as well as Southeast Kansas area, if able within the findings of the 2023. Add language requiring the Secretary of Children and Families to submit a status report to the House Committee on Social Services budget on or before January 1 of 2023. This additional funding would create a total of $796,240 for Safe Families, Children of Kansas. Add $450,000 all SGF to recruit, retain, and train CALM bonus social workers and CALM super parents for 2023. Add language requiring the monthly rate for the independent living subsidy to go back to $350 instead of $700 once the federal CHFE pandemic funds are expended for 2023. Add language to require the agency to provide the Cerebral Policy Research Foundation of Kansas $125,000 from existing resources for the purpose of purchasing and providing durable medical equipment for individuals with disabilities in the state of Kansas for 2023. Number 6, the Budget Committee strongly supports the Children's Alliance request submitted to the Sparks Committee for expenditures totaling $24 million for the purpose of emergency child welfare workforce recruitment and retention incentives, $10 million, including $5 million noted in item 1, establishing a grant fund for child placing agencies to develop pilot programs to serve youth with complex needs who are placed in foster care, $10 million, and workforce needs for psychiatric residential treatment facilities, $4 million. I'll stand for questions.
All right, thank you, Chairman Carpenter. And I kind of want to go back to a discussion that we had, I believe, on Monday in regards, or maybe it was last week, in regards to the budget that came for the correctional facilities or corrections. And the reason why I'm asking this is because there's been mentioning of TANF dollars in DCF, and I just wanted to make sure that we had the funding for JAG-K in the corrections department. We do not have a duplicate line item for TANF for JAG-K.
No, we do not. Well, actually, that's the increase in TANF. That's to actually increase the TANF or the JAG-K folks in the rest of the state. That is, so in TANF dollars, it's around $5 million. Let me find it here.
I just didn't see an offset, so that's why I was kind of asking about that question.
No, it's an increase. It's not an offset. It's not decreased. There's $5 million, $5.3 million, I think it is, or yeah, 5.3, yeah, $million for out of TANF for the JAG-K program as it currently exists. That money from the Department of Corrections is for expanding that program.
Okay, thank you for elaborating on that. The next, I have a question in regards to the capital improvements. We're talking about the request from the department was $150,000 for the renovation of the first floor lobby, interview rooms, and also technology. And then the governor only recommended a partial amount of that for $450,000. And I guess my question is, because that's all coming from SGF, is that desperately warranted?
The $450,000?
Yes.
I don't think we had a discussion on that, quite frankly.
All right. Representative Humphreys.
Thank you, Mr. Chairman. I just wanted to touch real quickly on the $1 million extra in SGF for foster care. that went up from the prior estimates. And, thankfully, and I think it's, partially because of Families First, we have less Kansas children in foster care. So I'm just curious if you could elaborate a little bit on acuity and service needs, what that means and how with less kiddos that is an increase of $1 million.
Chairman Carpenter.
Sure, and I appreciate that question. And what we've done is we've lowered our foster kids by about 1,000 this last couple of years, but what we've done is we've picked off, if you want to use that for a word, we've taken out the easier ones to place. And so now what we're left with is a lot of folks that are have special needs, ID and all that, and you see that's the money for some of the other facilities, other than foster care folks, Safe Families and CALM, that's their specialty, is taking care of, well, Safe Families First keeps them out of the foster care system first. And then CALM is for very labor-intensive, high needs kids. And so what we've got left, and I'm not being derogatory here, I'm just saying that that's the situation with the foster care. So what the ones that we have left, the expenses go up because they take way more services.
Thank you. That makes sense. Thanks.
Representative Wolfmore.
Thank you, Mr. Chair. I have a couple questions. The item 1 and 6, 24 million total, that includes the number 1 and the 5 million, that we're hopeful will come out of the federal funds, the Spark funds. Or is that a one-time expense?
Chairman Carpenter.
Are you talking about committee recs?
Yes, I'm sorry. The
Okay.
committee recommendations,
Okay.
number 1, I know is included in number 6 with your recommendation. Or is that a one-time spend?
It is.
Good.
And I'll just kind of, here's some justification for that. The Children's Alliance requested $10 million, all for the purpose of workforce recruitment and retention. The funding addresses child welfare workforce crisis in order to continue efforts to address behavioral health services for youth with complex needs. Depending on the organization, region, position, child welfare providers experiencing between 15 and 30% vacancies. The revolving door of workers has led to increased caseloads and higher stress level. The agency requested one-time emergency workforce recruitment retention incentives for child placing agencies and DCF licensed residential facilities, including qualified regional treatment programs. This financial assistance will provide sign-on bonuses, stay recruitment bonuses, and other incentives to recruit and attract workers, such as tuition support and paid internship. So
That sounds fine. I was just hoping it was one time. It's more likely Spark
It is.
will take it under consideration if it's a one-time expense. Thank you so much, though. And then my second question is, what is the CALM bonus for social workers? I'm not familiar with that.
yeah, let me find that. Okay, here it is. CALM is a child placing agency sponsoring, supporting, and training licensed foster homes. CALM is a grantee now of DCF. I think their budget for DCF now is about $2.1 million. And CALM has a high retention rate for foster parents who would like funding to further assist high-risk foster care children with complex care. The CALM pilot program is an innovation to recruit the CALM super parents and retain CALM bonus social workers to assist the needs of family. CALM would like to expand their capacity by 30 additional high-needs beds for children identified with disabilities.
So an effort to attract more social workers.
Yeah, and again, again, what I said earlier was a lot of these kids that we have left with are high needs, very difficult to place children, and this is perfect for that.
Thank you very much. Thank you, Mr. Chair.
Representative Hoffman.
Thank you, Mr. Chairman. I'd like to go back to what the chairman was talking about earlier on the capital improvements. So on page 1061, it's talking about the capital improvements. The Topeka Service Center, do we own that, or is that leased?
I don't know.
Chairman Carpenter.
I do not know that answer.
We own. Okay, Amy's telling me we own it. Okay. So it's not the main building. We were thinking it was that they're wanting to
Over on 6th.
yeah. So the 850,000 was wanting to do all this. Did they talk about what they would do with just the 450,000?
Chairman Carpenter.
Let me look here.
And then maybe while you're looking at that, this might be a question for Amy. The project maintenance reserve fund, how is that paid for and what is that for?
Amy.
Thank you, Mr. Chairman, and I apologize if I may have to clarify because I'm doing this from memory. It's a lease-to-own arrangement, so we're under the terms of the agreement, the state has agreed to contribute to the maintenance reserve fund a certain amount to maintain the building to a certain level. So the projects are funded from within that fund for that building.
Okay, so that fund is simply for that building.
Correct.
Okay, so I wonder why they didn't. Did you ask them why they didn't ask for the 850 out of that fund at the beginning instead of SGF?
If I could also interject, what is the balance of that fund?
Mr. Chairman, we'll have to get that for you.
All right, thank you. Chairman Carpenter.
Well, my explainer is just continue the renovation of the first floor lobby and interview rooms at the Topeka Service Center. That's the only.
I just don't understand if they've got a fund that's what it's for, why they asked for SGF money instead of going to the fund in the first place. So,
I can get
and it
back
may be how much is in it might be part of the issue. So,
Yeah, I can get back with you on that.
Okay,
This
appreciate
time I don't
that.
have
Thank
any
you.
information. Thank you.
Representative Sutton.
Thank you, Mr. Chair. I look at some of these programs, like the Safe Families for Children and the Calm Bonus Social Workers and Super Calm Parents. I believe that these probably save us money in the long run. I think there's a serious cost avoidance there. But do we ever get any sort of an indication as to what costs have been avoided, what we're getting for the investment?
Let me look here. Yeah,
Chairman Carpenter.
Those are pilot programs. I do not have that information on this first round of those.
Right.
But I plan on getting information our committee does in the future and they do have very good stats. Do you have any more stats on CALM? But they do have some very good outcomes.
I believe that. If I could continue, Mr. Chairman.
You may.
I believe that, but until I can measure it, it's really an act of faith. And I'm not 100% certain an act of faith is an appropriate measure for appropriations.
Okay, well, let me enlighten you. How would that be?
That'd be fantastic.
A small child placement agency sponsoring, supporting licensed foster homes. They're a grantee already with DCF. They contract with ks and the MCOs to provide voluntary children's residential replacements for children qualified for ID or waiver services, HCBS waiver or HCBS waiver service, Medicaid funding placed in our licensed home. Each licensed CALM worker has a minimum of 20 years experience working with family well-being system, primarily as a frontline worker supporting foster parents. CALM placed 718 children in our sponsored licensed homes in 2021. 82% of the children placed with CALM are in DCF custody. 20% are placed with children's residential IDE placement qualified for KDAD's HCBS funding. 75% of the children placed with CALM have complex needs requiring intensive 1 or 2 or ID tier levels 1 and 2 rates of care. 21.3 62% of them, DCF children placed with CALM need basic 1, 2, and 3 levels of foster care. So they're very high needs, and it's very hard to find placement for those.
And I get that. And you said there were 718 placed last year, is that right?
Yep.
Excellent. Now, just one more, and I'll wind it up.
That's fine.
What does that translate into as far as a cost savings for the state?
Chairman Carpenter.
Yes. I'm not sure that it saves any money, but it is where we place those kids where we normally could not place them anywhere.
And, okay, sorry. I have to go one more.
That's all right.
That's fine.
Thank you,
Representative
thank you,
Sutton.
Mr. Chair. All right, if they weren't being placed, where are they then?
Chairman Carpenter.
Representative,
It would be homeless.
yes.
Representative Ballard.
I think the savings, if there was any, would be in the fact that they weren't institutionalized.
Right.
That they get to stay in the homes, and they have to stay in the homes, but they have trained people working with them in the process. If you start that early enough, you can take care of some of those problems, and they don't get in that system, and we end up having to either incarcerate or put them in an institutionalized from that standpoint. So would we save a lot of money? I am not sure about that, but I do know that we would be working with in a more closed environment, which stands a better chance for rehabilitation in the process. And I think then if you don't incarcerate, you're saving money. If it's not a habitual thing that's repeated all the time, you're saving money. But you're providing those services that most vulnerable children need because they're at a level that some foster homes won't take them because it's too complex with other foster kids. So from that standpoint, you can save some money, but I think you can save maybe that individual better with where the placement was. Does that make sense?
Oh, it does, it does. All right, but I still want to come back to if these children weren't placed by CALM, where would they be?
Representative Ballard.
They would probably, if there were wards of the state, still be in the system. But I think these are those children that we say get lost in the cracks because they may go from home to home to home to home. Because if we take custody of them, we have to take care of them.
Right.
But this is just maybe in a better environment, hoping that we can take care of their problems earlier. But either way, they're going to be in the system.
Okay.
It's just a matter of where we place them and what's maybe the best environment for them at the time. And the CALM program, I wish you had heard the presentation, because we're talking about social workers, skilled people knowing how to handle this situation. And yet, if they have any family ties, they incorporate the families back into this so that if there's problems really in the family, they're taking care of the family, as well as trying to help with the children, so that if they should ever go back home, they have a better environment. And I don't know if that really answered your question, but if not, get down to the point and I'll tell you a little bit more about it. But is it absolute for how much money we saved? I can tell you one thing, they still remain in the system.
Right.
Because these are children that would be very difficult to be adopted.
Makes sense. All right. Just as a follow-up there, I would be very interested in seeing a kind of a long-term or longitudinal sort of analysis of the success or lack of, depending on the results, obviously.
I don't disagree with you. Tried to look at outcomes data for years and years on a lot of these programs, and it's very, very difficult to come by to actually see what the cost savings is. And I do have some proposals that we do have cost savings analysis, but this is more about just taking care of the kid and not placing it in a group home or with a provider or anything like that. So it is a better environment for these children.
Excellent. Thank you. Thank you, Mr. Chair.
Representative Landwehr.
Thank you, Mr. Chairman, and I'm going to ask the Secretary to give me a nod, yes or no, on what I'm saying here so I don't get off track. I think it's really hard to show what those savings are because institutionalization is a lot more expensive than a foster home is. Juvenile incarceration is a lot more than a foster home would cost us. So if you just, kind of envision that expense over here, institutionalizing versus in a foster home, and as Representative Ballard talked about, these are the kids that bounce, 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 bounce. So these have to be homes that are specially trained to deal with these types of kids. It may be your runners, it may be your fire starters, it may be your sexually active kids. Then you can look down the road, if we can help turn these children's lives around, then they're not incarcerated as adults. That's your savings.
Mr. Chairman, I do have
Chairman
some
Carpenter.
answers to Representative Hoffman's. Apparently, the Department of Administration did not allow them to access that fund, that building fund, and so this came out of that.
Any further questions for Chairman Carpenter on the Department of Children and Families? Seeing none, Chairman Carpenter.
I would make a motion to approve the 22 and 23 budgets for the Department of Children and Family.
All right, committee, you've heard the motion. Is there a second? Seconded by Representative Ballard. All those in favor of the motion say aye. Aye. Opposed? Motion passes. Chairman Carpenter. All right, Chairman Carpenter.
I'm taking my time so I can compose myself, Mr. Chairman.
It's going to be all right.
That was the one thing that I said I was going to do, just relax and take my time. Committee, the Department of Aging and Disability Services, KDADS, was established by statute in 1977 as a cabinet-level agency known as the Department of Aging until 2012. The agency is headed by a secretary appointed by the governor, subject to confirmation by the Senate. Its goals are to promote security, dignity, and independence for older adults and persons with disabilities. KDADS is responsible for Medicaid long-term care payments, survey and certification of adult care homes, behavioral health programs, home and community-based services for older adults and persons with disabilities, and the management and oversight of 4 state hospitals. KDADS is mandated under the Federal Older Americans Act to serve as an advocate for seniors and to administer programs funded by the Older Americans Act, Appropriations. The agency requests a revised estimate of $2.4 billion, including $894.7 million SGF for 2022. This is a decrease of $6.9 million below the amount approved by the 2021 legislature. Significant items in the agency's estimate include the following: continue the COVID pandemic relief fund in 2021. The agency received a large influx of COVID-19 pandemic-related relief funds. Some of this aid was provided through direct distribution from several federal relief acts, which the agency passed on to the appropriate organizations for disbursement. Subsequent to the calendar year 2021, the budget discussion, the agency received more federal monies from the Federal American Rescue Plan Act to be provided to organizations in 2022. Additionally, the agency continues to receive increased federal medical assistance percentage, FMAP, increase rate for the federal public health emergency as the federal public health emergency continues. 10% increase in FMAP rate for HCBS services included in the ARPA funding. The agency anticipates to receive increase in FMAP rates for HCBS services. ARPA included provision that the increased FMAP rate was an incentive for states to invest, supplement, and strengthen their home and community-based services. The agency views this increase as an opportunity to study some of the issues surrounding the waivers as well as provide some relief to providers. It submitted a plan to the Federal Centers on Medicare and Medicaid Services, and I think it says awaiting approval, but I'm sure we've already have approval for that. Delayed implementation of programs. There were several projects the agency originally anticipated would begin in 2022. These included installation of infrastructure for the electronic health record system at the 4 state hospitals and the establishment of the acute psychiatric beds for youth at Hayes. Both these projects were delayed due to the contract procurement process. Additionally, the project to remodel building at Osawatomie State Hospital was delayed due to supply and labor issues associated with the COVID-19 pandemic. As a result, a new estimate was drafted for the cost of the remodel, which the revised estimate was $1.7 million higher than the original appropriation, which the agency subsequently requested as a supplemental. The revised estimate includes 325 FTEs, which is an increase of 29.5 FTEs above the positions for 2021. The governor recommends $2.3 billion, including $830.7 million SGF for the expenditures in 2022. This is a decrease of $78.1 million below the agency's 2022 revised estimate. Significant items in the governor's recommendation include Human Services caseloads. The governor's recommendation adopts the fall 2021 Human Services consensus caseloads estimate. This was a decrease of approximately $89 million, including $66 million SGF below the agency's revised estimate. This decrease is due to a lower than anticipated Medicaid eligible population that was originally estimated in the spring of 2021. The governor's 24/7 pay plan, the governor recommends including $9.6 million, all from federal ARPA related funding to allow the salary increases for the nursing staff at the state hospitals. The governor's pay plan includes both permanent increases in the base pay for certain nursing positions as well as temporary increases if facilities meet certain criteria. The goal of these increases is to assist the state hospitals with retention issues that they historically have faced, which has increased due to COVID-19 pandemic. Crisis intervention services, the governor recommends, the recommendation also includes $2 million SGF for the implementation of the crisis intervention centers. Currently, the state has several crisis stabilization centers which provide services to individuals on a voluntary basis who are experiencing mental health crisis. The funding aims to provide KDAD's funding to establish a new classification in the state to allow involuntary patients similar services within the community. These additional services aim to reduce the number of involuntary admissions to the state hospital. The governor's recommendation also includes 325.5 FTEs, which is the same number as requested agency 2022 revised estimate. The Sparks Committee concurred with the governor's recommendation, and we had 4 recommendations to the Sparks Committee. We note our support for the Midland Cares $2.5 million PACE expansion proposal in the Sparks Advisory Panel. The committee also notes its support for $4.5 million in recruitment and retention of LPNs and RNs proposally submitted to the Sparks Advisory Panel. Committee notes its support for the Associates of CMHC's $4.8 million CCBHC implementation mini grants proposed by the proposal to the Sparks Advisory Panel. And we also note our support to the Association of CMHC's Kansas capacity building and issue proposals of approximately $342,870 to the Sparks proposal. And I'll stand for questions on that. And then, Shirley, will you hand out my handouts, please? Both of them. We might as well just. Yeah, just do both of them. Just do both. We're going to have conversations about both of them. And I'll stand for questions on 2022.
All right, committee, are there any questions for Chairman Carpenter in regards to fiscal year 2022? See none. We may move on to 2023.
Okay. For 2023, the agency requests $2.3 billion, including $903.4 million SGF for 2023. This is a decrease of $19.4 million below the agency's 2022 revised estimate. Significant items in the agency's requests include the following: decrease the pandemic funding relief expenditures. The agency anticipates pandemic's conclusion. The request for pandemic-related expenditure decreases. As such, the agency's 2023 request reflects a decrease of $10 million in COVID pandemic-related transactions. Return to the regular FMAP distribution. Similar to the agency anticipates the increased FMAP associated with COVID-19 pandemic will end in 2022. As such, the agency's submission reflects an increase of $87.8 million SGF for the increased utilization of state funds for the HCBS waivers. Enhancements related to the Medicaid services, the agency requests $34.7 million, including $13.8 SGF for several enhancements related to Medicaid services. These enhancements are primarily centered around standardized reimbursement rates for waivers and increased funding to address waiver wait lists. Staff notes for more detail. These enhancements request 2 in the enhancement section. Enhancements related to the HCBS ID waiver. The agency requested $21.5 million, including $9 million SGF for several enhancements related to the ID waiver. These enhancements center around raising the reimbursement rates for specialized nursing services to match the rate of the TA waiver, the funding in order to bring the individuals off the wait list and onto the waiver. More details can be found on request number 3. Enhancements related to oversight of facilities. The agency requests $14.7 million, including $9 million SGF for several enhancements related to the agency's oversight of adult care homes. These enhancements are generally related to increasing the agency's staff to survey these facilities, as well as additional funding to supplement its statutory background check requirement. You can find more information on request number 4. The revised estimate includes 341.5 FTEs, which is an increase of 16 FTEs above the number for 2022. This increase is due to the enhancement request for additional staffing. The governor recommends $2.4 billion, including $970.4 SGF for 2023. This is an increase of $20.4 million, including $67.0 million SGF above the agency's 2023 request. Significant items in the governor's recommendation include continuation of the 2022 initiatives. The governor recommendation includes the addition of 28 million SGF to continue funding associated with the salary increase provided in the 24/7 pay plan, as well as funding for the crisis intervention centers. For 2023, the governor recommends expenditures for the 24/7 pay plan be funded out of SGF monies rather than ARPA funds. You can find information about that on 1106, and just a breakdown is it's $10 million for the crisis centers and $18 million for the pay plan. Expansion of mental health services. The governor recommendation includes 19.3 million SGF for additional funding for mental health services. This includes initiatives to reduce the burden on state hospitals through expanded funding for mobile competency evaluations and expansion of regional hospital beds to provide inpatient mental health services. Shift the funding in mental health expenditures. The governor's recommendation includes shifting sources of approximately $13.6 million from mental health related services from special revenue funds to the SGF. These shifts move the expenditures from the Highway Fund and the Children Initiative Fund into KDA's budget. You can find information about that on 1108. Decreases associated with enhancements. The governor recommendation also includes a decrease of $35.3 million, including $7.7 million SGF associated with the governor not recommending adoption of several of the agency's enhancement requests. You can see more of that on 1109. The governor The governor's recommendation also includes 330.5 FTE positions, which is a decrease of 11 FTE positions below the agency's 2023 request. This decrease is due to the transfer of CanCare Ombudsman and to the Department of Administration and a partial adoption of the agency's enhancement request for additional survey and credentialing staff. The Budget Committee concurs with the governor's recommendation for 2023 with the following adjustments. Delete $15 million SGF to remove the governor's recommendation for 50 additional regional beds in 2023. The committee notes and understands the need to grow the capacity for regional mental health beds. However, would like a report from KDADS during the 2023 session outlining current beds available and the strategic plan to staff these proposed beds prior to consideration of this item. Add $68.4 million, including $27.4 million SGF for a 14% increase to the reimbursement rates for providers of home and community-based services, intellectual and developmental disabilities waiver for 2023. Last year, our increase was $31 million all funds, $12 million SGF. It raised on the 20,000 employees that that work for the providers out there that take care of the ID system. It raised the rate an average of about $1.50 an hour. So this figure will raise it to $15 an hour. The agency will survey. Last year we had reports that over 97% of the money went to salaries, and the agency will survey the providers to make sure that that money is spent directly on wages. Add $12.5 million, including $5 million SGF to provide a 4% reimbursement rate for providers of Medicaid behavioral services for 2023. Add $11.8 million, including $4.7 million FGF for provide a 10% increase in the increased reimbursement rates for providers of home and community-based services, frail and elderly waiver services for 2023. Add $7.7 million, including $3.1 million SGF, and add language to increase the reimbursements of the T1000 medical code for specialized nursing care from $43 per hour to $47 an hour in 2023. Add $2.5 million, including $1.5 million SGF to increase the amount provided to community developmental disability organizations. We have two different organizations there. The CDOs are the providers, and the CDDO is the organization that oversees the providers, the placement, and the licensing of the ID and DD providers. So I always get those confused, but that's the difference. This is an administrative organization. Add $500,000 all SGF for Foster Adopt Connect to offer behavioral interventional services for children with behavioral and emotional issues for 2023. Add language to direct KDADS to enter in agreement with the community mental health centers to establish rates to conduct mobile competency evaluations for 2023. The governor's recommendation already includes $2.8 million in funding for the mobile competency expansion in an effort to reduce wait times for state hospitals. Add language to allow the agency to establish guidelines for nursing facilities, request a waiver for staffing requirements compatible with CMS rules for 2023, and investigate similar guidelines for adult care homes in 2023. I'll stand for questions.
Actually, Chairman Carpenter, I think you passed over item number 3.
Oh, I did? Oh, I did. Thank you. Thank you. Not on purpose, because
it's a pretty big item.
It
so
is, and I welcome that
conversation. If you could please describe that for the committee.
It was intentional.
And I have a whole folder here that will.
Flying under the radar.
Yeah.
So please describe item number 3.
Thank you, and I apologize, and sincerely, I did not mean to do that. Add $65.2 million, including $26.2 million SGF to provide a full rebase of the nursing home facility daily Medicaid rate for 2023. This amount is a difference between the amount of fully rebase the daily rate and a 3% increase already included in the governor's recommendation for 2023. This full rebase amount is based on the calendar year 19, 20, and 21 cost data. However, the data for the calendar year 2021 is an estimate. I'll stand for questions now. Thank you for
All right, thank you, Chairman
correcting
Carpenter.
me.
And then also in item number 6, this is obviously something that we've always had, I guess, contention when we're in conference with the Senate. So raising that to $47 per hour, which would be 3.1 million SGF. And in conversations that I had through the past few days, that $47 per hour is not even the going rate right now. Is that correct? It's higher than that.
It is, but I had some other big asks. I didn't ask for the moon. I just asked for, but yeah, you're exactly right. But to Representative Sutton's deal, this is a cost savings deal to raise that. You know, it costs, I've got stats here. Let's see what we're going to talk about.
I guess my question is what is the standard rate right now to provide these services above the $47?
Well, you know, with contract servicing, which is a lot of these providers are doing, it could be anywhere. I mean, it could be $100 an hour. You know, this is just a pre-COVID type of look at $47 an hour. But, you know, with what we've got in the contract services for nurses and stuff, this isn't even on the radar screen.
All right, thank you. I want to go and on page 1099 in our budget books, on bullet point number 2, it has returned to the regular FMAP distribution. And so the agency had asked for $87.8 million SGF for the increased utilization of state funds for the HCBS waiver services. So my first question is this in regards to the enhanced FMAP from the federal government?
It is.
2, are they asking for an increase because we increased the services and added items with the enhanced FMAP, and now we're trying to rebalance that with the $87.8 million request? Or is this just additional services that we need to provide?
Well, this is just, keep in mind that this agency did this budget back in September, so they're just thinking about what they need to cover. It doesn't cover any of the things that we are covering in our budget committee or additions. This is just the money that they will need, the savings, part of that $515 million that we have received extra from the 6.2% FMAP. This is what happens, and why I've been railing on when this goes away, this is what happens. This is just to take care of that funding decrease when that 6.2 goes away. So it's just going to keep it whole for those items. Now, additionally, we didn't do budget recommendations, and we weren't in the budget process, so okay.
Well, I guess my line of questioning is whether or not we increase services with the enhanced FMAP, and now we're going to have an ongoing expense of nearly $88 million a year, or is this just a rebalance with the enhanced FMAP going away for 1 year only?
Well, that'll be ongoing expense because we've collected $515 million worth of.
That's a cautionary tale of regarding the enhanced FMAP. And that was one thing that we should have been cautious about, and not increasing services that is going to be an ongoing expense in future years.
I don't look at it as increased services. We did in social service budget, but this is actual money that we saved. Not necessarily increased services, but that we saved 6.2%. We saved that by the federal government reimbursing us at that higher rate. So there were ongoing services that we recommended last year in social services budget and that kind of stuff, but this is just for ongoing. It's $68 million a quarter that we get extra through KDHE, KDADS, and all of our federal Medicaid rates, the FMAP rate. It's $68 million a quarter, and again, you heard me at the very first meeting that we had talk about this. It's $5.1 million that we've deferred SGF savings in the tune of $5.1 million. So if we would have been going on now, as this ends, the bill becomes due. We saved that much money, but now you're seeing what we would have spent if we wouldn't have had the increase.
So it's a rebalance.
It's a rebalance.
That was
Okay.
my initial
Sorry.
question. Is it a rebalance,
It's a
or is it
rebalance.
additional services that were added due to the enhanced FMAP? So it's a rebalance.
Right.
Okay. Representative Williams.
All right, thank you, Mr. Chair. So it's hard to look at these budgets, and so what we're seeing is that the governor, she approved all of the agency's recommendations except for she added 20.4 million, is that correct? No, she decreased a few. She decreased at least one on the list, is that right?
Yeah, she didn't recommend she did not recommend the enhancements. It would be on page 1109 in your booklet, but she did not recommend the community developmental disability organization allocation, which we put back in. That was an agency rec, but she did not recommend the funding to reduce the ID and the PD waiver wait lists. $24 million, $8 million, 9.8 million SGF, fingerprint background checks of 4.8 million, additional state hospital FTEs of 87,000, she adopted partially the addition of the survey and credentialing positions. And so it was 1.7, including 1.3 SGF, and she recommended 838,000 and 635,000.
Okay, so a couple comments. Number one, your subcommittee is recommending addition of $153 million. That's the total of that, correct?
I thought it was 156, but maybe I misadded.
And that's all funds.
All funds.
All funds, it says 153, but
Okay.
53.7. And I know you have what I think is the toughest budget, and every year we come back and the governor has not put these items in. So my question would be kind of an agency question. We see what's provided here, an agency asks, and then we see the additions on top of that. Why does that happen every year? That somehow there's a disconnect between what the governor has asked, or what the agency is asking the governor in November, and then what we are being asked to add on to it right now. So that question. And then my other only comment is that it's difficult to follow all of these because you really have to go like check mark and say, she added this one, she subtracted this one, we're adding this one. It would be amazing in these reports if it was a chart that showed the items, especially for complex budgets such as yourself. So we could literally see across the line what was saved and what was not. Just a comment. So on the first question.
I can appreciate that very much. Representative Ballard wants to weigh in on that first one, but I will tell you, it's through the budget process, timing. They're doing their budget in September, October. We're having hearings in January on a lot of these things. And a lot of it's committee testimony through the process that we bring this back. It's just like nursing homes. The governor put 3% in there. The amount that I put in there is to fully rebase the nursing homes, which is in statute and we're required to do. And yesterday we had a little conversation about not following the statute or following the statute. But the truth of the matter is we haven't followed the statute for a long time on nursing homes and fully rebase them like we agreed to back in I think it was 2006. Let me look through here and find. But these are just things that happen through the process. Okay, here it is. It happened in 2008. This was entered into the subject Provision Appropriation Act, Secretary, increased nursing facility reimbursement rates. The Secretary of Aging and Disability shall implement a base year model of reimbursement for nursing facilities. For fiscal 2008, the information from a cost report from the years 2003, 4, and 5 shall be averaged together to be used to calculate the base year. For fiscal 9 and each fiscal year after that, the information for the cost reports for the 3 most recent calendar years preceding beginning the fiscal year shall be averaged together to use to calculate a base year. The Secretary of Aging and Disabilities shall not apply the 85% rule regarding the number of beds filled to nursing facilities with 60 licensed beds or less in determining this facility. Now, this is law. This is KSA 755958. We have never done that. The governor added 3%, and if you look at my chart, I have a chart here that I can show you what the difference is, and it's like 30, from what we should have done to what the governor put in there, which is what we do, the standard 3%, the difference is $26 million. So the difference is $65 million in all funds. So the governor put in the 3%, which is $21.5 million, 86 million, 8.6 million in SGF. And in fact, that should have been what we're talking about here, 34 million, 86 million. So this is statutory. And these nursing homes have been getting the short end of the stick for a long time. And COVID has just brought it to the forefront. And they are desperate. And if we don't want to fund this, we need to figure out where we're going to put these folks. And it's that simple.
Mr. Ballard, did you have additional comments?
I was going to, you added the part I was going to add, that if it's statutory and stuff you have to do, we don't have much of a choice.
Representative Landwehr?
Thank you, Mr. Chairman. Have you guys gone back and looked to see if they have revised the rules and regs? Because one of the problems that was discovered in 17, I believe it was, that the rebasing was set at, I believe it was 7 years in rules and regs versus the 3 years in statute.
Chairman Carpenter?
I have not. This is the most recent one that we were able to pull up. So.
Yeah, so I think what's happening is we've got a conflict, and this is why the rules and regs are so important to be monitored, because they're law. So which one do you obey? Statute should override that, but that's not what the agency had chose to do at the time.
Representative Williams?
The other comment is based on your response and that we hadn't done this rebase since 2008. The other thing that would be so helpful, rather than have paragraphs of information, is just to have the statute rather than having to dig for it in here next to it. And when was the last time we made an adjustment? So if the adjustment, because some of these things we looked at last year, maybe we did or we did not approve the enhancement. And so we're just relying on our chairs to provide that information when there might be a much easier way to provide that, because I'd like to know how often have we increased IDD? How often? When was the last time? And it's hard to get that in a short amount of time in our limited amount of time here.
And I guess I'll take responsibility for that and try to have that information relayed to us before we put the budget together so we can see exactly what happened. And I'll probably go back to fiscal year 19, 20, and 21, and 22 and just see if there were increases, and we can have research provide that to us when we put the budget together.
And the only last comment is that sometimes it's even just the way that we receive it. It may be that it was provided for us, but it's provided for us in these large chunks of information, and there may be a better way to lay it out so we see it as a comprehensive unit so we can actually make decisions, more informed decisions.
Well, and going back to, I think, Representative Williams' initial, question is, the agency had requested these items. The governor didn't have that in her budget, and then the budget recommendations are like going back to number 6 that I mentioned in regards to going to $47 an hour or the rebasing. I mean, the governor is fully aware of the statute that's on the books. So what was the discussion as to, or was there any discussion as to why the governor did not recommend the enhancements, but then the budget committee added those recommendations on?
Well, our committee did what we needed to do to protect these folks. And if the governor doesn't want to do that, we have a statutory, I think we have a responsibility to provide that. And
So are you saying the governor is breaking the law?
I'm saying the governor makes different fiscal decisions than we make when it comes to priority of the people of the state of Kansas.
I'm just making a joke there. So, Representative Humphreys.
I'll second your motion.
Thank you. I think I have an easy question. So in your recommendations, number 2 through 7, you're adding, and I just want to make sure that I understand. Generally, 2 through 6, it's about 40% SGF and then 60% other funds. And so is that all federal funds? And is it automatic if we increase, then the federal funds increase? And then number 7 is more like 60% in relation SGF versus other funds, but just a little bit of explanation
Okay.
about those numbers.
Chairman Carpenter.
Thank you.
Which one? Let's take them one at a time. Okay.
I don't mean to make this long and drawn
No,
out.
not at all. I just need to.
2 through 6.
2.
Through 6, when I look at what is SGF versus how much you're adding, it's about 40%. SGF is about 40% of those numbers.
It's actually 64, right now, it's at the 6.2 differential. So, yeah, it's 60-40, a little bit more than that.
And that's all federal funds that just automatically flow to us. If we increase, they increase.
Right.
Okay. And then number 7 is more like 60%. Is there an explanation about that one?
Yeah, and what may have happened with that is they may not have computed it at because that was an ask that they did, knowing that the FMAP was going to be away. It may have went back to a more what we used to do, which was a 56, 57% versus the 64. So
Okay.
that might be what the difference is on that. I'd have to check that out.
Okay. Thank you. Just need a little explanation. I appreciate
sure.
that. Thank you.
Well, committee, I have some other stuff that I want to talk to you about that happened with these nursing homes. You know, year over year, last year they spent $16 million, and this is only 55 homes out of the 370 we have or so. This was the only ones I could get information on. They spent, in 2021, they spent $16.7 million more on contract nursing. And in it was 16.7, and in 2020 it was 9.9 million. So, you know, during this COVID, they have gotten pounded with this contract nursing, and that's one of the things right here. Number 10, I think is so important, and I haven't gotten any questions on it yet, but I'm going to go ahead and explain that. Add language to allow the agency to establish guidelines for nursing facilities, request a waiver for staffing requirements compatible with CMS rules in 2023, and investigate similar guidelines for adult care homes. We have a more stringent nursing home guideline than the federal government. The federal government, CMS, allows nursing homes to apply for a waiver. If they cannot, it's a very drawn-out guideline, and I do have it here, but if they basically cannot find nurses and stuff like that, they can apply for a waiver. And it has to do with the distance that the nurse, or, you know, we have nursing homes that are right next to a hospital, you know, but they still have to provide 24-hour care for RNs and that kind of stuff. Well, when they can't provide that, it costs, they have to go to a staffing agency. And we had testimony, and I think you've heard about it in committee, that over Christmas holiday, one nursing home paid over $9,000 in staffing over Christmas holiday this year, Saturday, Sunday, and Monday, or however it works, just to staff that. And one nurse made $450 an hour, or it was at least the agency was charged that. So those are real costs. And if they don't do that, we fine them because they're understaffed and they're not doing their statutory requirement. So this is to loosen that up, not to put anybody in safety, but this is to loosen that up to CMS's own rules. When's the last time you ever heard of a state being more restrictive than the federal government? So anyway, that's what that one is.
Representative Hoffman.
Thank you, Mr. Chairman. And my question kind of is off of what Representative Humphrey was saying. So if I understood you right, the 2 through 6 is under the FMAP right now, and it hasn't been rebased? And 7 has been? So would that, or is that based under what we think it's going to be?
Chairman Carpenter.
Okay. Okay, so it's different. 7 is different because it's not a service, it's administration.
Okay, so they're based on our original FMAP, what we
Correct,
think.
'cause
It's
we're
not
not
based
getting-
upon the enhanced FMAP right now.
Right, because we only got
Okay,
that for services.
so that's not going to go up.
So, no.
Okay, thank you.
Representative Landwehr.
Thank you, Mr. Chairman. And I was just, part of it I was going to add on to was where Representative Humphreys was going is that federal match is our Medicaid match. That's all federal dollars. And it goes anywhere from about 56 to 60%. It just kind of varies. And actually, if I recall correctly, Representative Carpenter is with the enhanced FMAP, that wasn't necessarily going to services. That money was being used elsewhere. Is that correct?
That's right. We have 515 million. It may be more. It's more now, and it's going to go till the end of this month. But that's how much increase we've actually supplemented our budget. And so the ending balance in our budget this year of, I don't know, I can't remember the last time I looked at it. Somebody was quoting $3 billion the other day. But 500 million of that at least came from the federal government by decreasing our costs in Medicaid expenses.
Representative Landwehr.
Yeah, so I just want everyone to understand is that even though we got that, that does not reflect necessarily in all of these numbers in the social services budget. It reflects in our overall budget. And go back to item number 1, I kind of understand, Representative Carpenter, where you might be going with that, but I would be more inclined to make a motion that we not delete that item, that we put that item off to omnibus.
And that is a formal motion, Representative
Yes, sir.
Landwehr? All right, we have a motion seconded by Representative Wolfmore. Discussion on the motion. Representative Carpenter.
Thank you, Mr. Chair. I'm not against this. I just think that a lot of times we go down these paths without a clear direction. And I've had meetings with Sedgwick County and some other folks that are, have vested interest in this. But again, I've not seen a clear path, nor do I know how much it's really going to cost. Or one of my other concerns is that we end up with a Larned, that we can't staff it. So there are a lot of questions answered. This thing is 3 to 5 years from being completed. And I think there are a lot of questions. And my whole reasoning for doing this is to get people off a dead center and kind of try to formulate some kind of a plan before we enter into a 50-bed mental health hospital. It's that simple.
Representative Helgerson.
Well, let me first, the documents you handed out, are those the response from the agency to the questions you and I asked?
They are.
Okay, do you want to go through them at all? Or has the committee gone through them?
Sure, I'll be glad to.
Is that pertinent to the motion?
Well, the proposal is to put back the 15 million.
Right, yes.
And this is a breakdown of where the beds are going for that 15 million. As I read, this is the answer, is how they're going to spend the money.
I think the handout is actually not congruent with the motion.
It's, okay, that's,
This handout is current beds. It was kind of the inventory that we asked for because, in order to build a facility, we have to find the need, figure out what we need. And also, I think that one of those deals is the types of, which is very important, the types of mental health beds that we have, the adult here, and then on the second page, on the other side of it is children, so PRTF, and all those beds. And then the other one is just an inventory of the current beds and where they're located and what they are. They're color-coded, so they are what kind of beds they are, because I think it's very complicated when you start talking about a half a dozen kinds of beds and where they're at and all that kind of stuff. So anyway.
Representative Helgerson.
Well, when I read the private psychiatric hospital beds and see some of the figures, that seems to mesh up some amount with the discussion, but we'll put that off. The issue is whether or not we put in $15 million. And if you go back and look at the documents that the agency has provided in studies, they have said that this is public and private hospital beds. If we're going to build a 50-bed facility run by the state, we should have a lot more discussion than putting it in right now. This is something that should have been built up and gone through the committee process. The idea of dedicating psychiatric beds that are run by somebody else and that we're contracting, and yet they can be eliminated in the next appropriation bill is a whole different thing than if we're building or buying a 50-bed state-funded, state-run psychiatric hospital in Sedgwick County. You know, that's the, you know, then there's a whole question of how are these beds designed? Are they designed for short-term, 2-week stays, 3-week stays, or do they end up being 3-month or 6-month stays so we can keep them in Sedgwick County? Those kind of questions should be asked and dealt with in a much deeper document than, you know, what we're going to go through in the last month of the session. I agree and I concur with what the chairman has said. I think that it may be appropriate and may be necessary, but before you put the funding there, let's have some more detail about what's the game plan in the long term.
Chairman Carpenter.
And I agree 100%. You know, I actually look for to be, there may be a partnership between other local entities, but it's, right now, there's no detail. And this shouldn't surprise anybody because I've had conversation with quite a few people and said, I'm not against this, but we can't go forward responsibly without more detail about the needs and about who's going to do what. So I would oppose the motion, but I certainly understand I'm not against this facility.
Representative Wolfmore.
Thank you, Mr. Chair. I support this motion. So first of all, this, and then I'll get to Representative Helgerson's concern. So first of all, this has been talked about, especially in the Wichita area and many of their delegation for 5 years. It came through the Mental Health Task Force, Mental Health Modernization. It's something that we've been trying to do for years because we need the additional beds. So that's number one. Number two, all the motion is asking is that we put it off to omnibus, not that we necessarily do it, that we put it off to omnibus. I know there's talks going on where we think this might end up in Wichita right now. It's not necessarily a building that have to be built. It may be an existing building, so it may turn around much quicker than we think. And one of the things this would solve if we did it, or help solve, it helps the problem with Larned. So right now, Larned has to do all the competency evaluations. It backlogs Larned. So they're thinking that some of this new 50-bed hospital would help do some of those competency evaluations. So there's talks going on now. I think that we will have more information by omnibus. If we don't, or if we disagree with what we hear and decide not to move forward, we can do this. This just simply puts it off to omnibus if we can make a better decision based on better information, and I support that. Thank you, Mr. Chair.
Representative Kincannon.
Thank you, Mr. Chair. Well, Representative Wolfmore stated most of what I was going to say. I think that the answers to those questions are probably, and I'm saying probably, available. And I think if we would put this off to omnibus, we could have a plan, and we could see, and we could even have hearings for that matter. Chairman, did your committee have any hearings on the new facility?
No, that's part of the problem. You know, I mean, and Representative Wolfmore, if I may, Mr. Chairman.
You may.
You kind of answered my question. We've been talking about this for years. That's not going to cut it. You know, we need action. And I've told the folks that I've talked to from Sedgwick County, bring me some information about this. And if nothing else, the pulling of the funds makes them get off a dead center and provide that information. There's a lot of issues down there territorially, where it's going to be and all that kind of stuff. Not in my backyard, there's a lot of, you know, all that kind of stuff, where they're going to put it. But those things, a lot of those things need to be answered before we start funding this thing. And that's all I'm asking for.
Representative Buchanan.
So that kind of fulfills my question of whether to support the motion or not. I think that we do need those answers, but because it's been talked about, I would rather revisit it at omnibus than have to wait a whole nother year. So I'll support this motion. Thanks.
Representative Owens.
Thank you, Mr. Chairman. I know, well, first and foremost, I support a facility in South Central Kansas. We need it. That's the obvious part. It has been a platform issue for Sedgwick County, and I have ran into some of the same challenges. Requesting information, not receiving it, getting their platform that says we need a 50-bed facility, but not having any specific plan to execute. My question is this: it was my understanding that the city of Wichita, and Sedgwick County and others were going to propose a plan to the Spark subcommittee on this specific topic. Do we know if that plan has been submitted that we could then evaluate in this committee, if not approved through that?
Chairman Carpenter, do you have any insight on that?
I'm not aware of that. But
Okay.
it doesn't mean it didn't happen. I'm just not aware of it.
I know that the advisory panel that myself and Representative Wolfmore serve on, we did not see any application, but that it could have gone through health and education. So I don't know if Representative Williams may have some insight because she serves on that advisory panel. But I would assume that in the recommendation, if there had been an application submitted through the Spark process, it would have been notated, as they have in previous items that have been submitted. And we're not seeing that in here. So
Okay. Well, I just wanted to clarify that because, I mean, I could go either way on this motion, but the reality is the need is evident, but we need leadership in South Central Kansas to step forward with a hard and fast plan to execute. And I pushed for that early in this session. I've talked with county commissioners early in this session. Hey, here's the opportunity. We need this. Give us a plan. And if there's not a plan out there now that is something for us to operate on, I'm not exactly sure that a month from now we're going to have one that's worth operating on. So anyway, not sure where I'm at. Thank you.
Representative Wolfmore.
Just going to say, since this has been talked about for so long and we've never put money behind it, maybe that is sort of derailed any talks about this become a reality, because now maybe that we see some real money could behind it. I know talks are currently going on with the administration. So I guess my plea would be, what harm does it do to leave it into omnibus, get a lot more information, and then make a decision? It could be transformational, and it really helps. If this would happen, it helps the rural communities, because the more weight Wichita, if that's where it ends up being, if they take off, the more weight we take off Osawatomie and Larned for Wichita and people going to those communities, the more those beds open up for the rurals who don't have the opportunity to have facilities like this.
Follow up.
Thank you.
Owens.
Thank you. And I agree 100%. I'm in Harvey County, just north of Sedgwick County, okay? I have an empty hospital in Halstead, Kansas that would be fantastic for this facility. I've advocated it for years, but it takes leadership from those communities. It can't be a conversation. We can put a cart before the horse, or the egg or the chicken, money first, no money, plan, no, whatever. The reality is, without a plan, without an executable option, then it is just an idea and a topic of conversation. I am ready to move past a conversation and have an executable plan that we can push for and advocate for that very reason, because it will alleviate burdens in rural Kansas. It will provide opportunities in South Central Kansas. It will keep people closer to their homes and their families and open up all sorts of treatment options. I am totally for it. I want to see a plan very much. Thank you.
Representative Helgerson.
Yes, this has been around. It would be great to have it talked about. In fact, it goes back to 1990s when we talked about having a regional facility down in Sedgwick County to take off the burden of Osawatomie and Larned. You talk about that it's been there for 5 years and it's been talked about. You're right. I've talked to some people about it, but I clearly haven't been involved in it because there is not a consensus of how we do this. There is not a plan. In fact, most recently I was told, well, we were going to have it at the KU Med facility, and then we were going to move it near Ascension, but now business interests have said, we don't want to have it by Ascension because it would hurt economic development. You're talking about the idea of, is this an economic plan or is this a plan to deal with individuals that are on the streets, and or a plan to deal with those individuals that are picked up by our law enforcement? They can't get their heads together on this. And we haven't provided or we haven't done enough to lead them and say, this is what's necessary. You know, one of the most reasonable things that's talked about, but then it's immediately rejected by Sedgwick County is Prairie View, just up down the street. You know, we want to take care of the needs of that area. There's a hospital, as just was mentioned by the representative, and it's available. You know, we lose track that we shouldn't be making some of these policies, that they should come to us or the agency should put it out and lay it out. Most importantly, you don't want to start another state hospital if you can avoid it. And after going through the closing of a state hospitals, you know, and trying to put the money into communities, you can't afford it. Experience in just the last 10 years, we couldn't run this Osawatomie and Larned correctly. And so you're going to say we're going to have another state hospital in Sedgwick County when they can't even get their plans together? I totally agree that the people in Sedgwick County need the services. But I don't think that we move ahead with the money because suddenly we're going to take the burden off of those people, those policymakers, those county commissioners, those city council members, our staff, and say, you don't get the money till I see a written document. And a written document that makes sense. And they can't even decide whether or not it's state-run or community-run. You know, $15 million is the tip of the iceberg. I agree, $15 million for services is well needed. But $15 million when you don't have a written document, when the chairman had to, you know, scream bloody murder to get this document, raises real concerns for me. And we can still put the money just as easy back in at the end of the session in omnibus, because we're a long way from being done. But the most important thing is they have a plan. And if it is a plan, it is a written document, and that the agency and the committee gets a chance to look at it ahead of time.
Representative Ballard.
Thank you, Mr. Chairman. That was part of probably why one was being proposed. I would say that of all these, you know, proposals that you have here, the committee was pretty united. On this one, we had a lengthy discussion about, and some of my members didn't want to remove the 15 million. I compromised by saying it's not going to happen immediately, so therefore we have time to get the plan and everything else. Since we made this recommendation, I have had several people come to me. Wichita was never discussed, so I had no idea where this facility was being planned or anything like that. So it wasn't based on where it was. It was just based on there was a time factor and we didn't know. But what we do know about this is that those 50 beds, 25 will be private beds, 25 will be forensic beds. So we do know that portion of it. And because it is still down the road a little bit, we don't have all of the details. Now, had this motion been made that we were waiting for the report, I would have been strongly opposed to removing the money. But since it was worded such, give us a report with more details, it is. But the more I think about it, looking at it in omnibus, and I would say in dealing with KDADs, in most cases, I'd have to say if we make a request, we get a response. So what is it that we specifically have to do? The more this argument goes on, it doesn't seem like it's a KDAD's problem. It's a location problem and where it's going to be, and we've gotten caught up in that. But in terms of, is there a need for the beds? Yes. We have to know specifically what kind of beds we're going to get. So from that standpoint, putting it off to omnibus in a way says the report can be delivered to us by that time if we're really serious about it. And, you know, for that reason, and because it was a little bit controversy, I will support the amendment because it is still doing what we ask here. Give us more information. Thank you, Mr. Chairman.
Representative Johnson, did you have?
Yeah, thank you, Mr. Chair. And I think we would be in agreement that we want the plan. And I think we can review it in omnibus, whether it is in or removed, because we could add it back in omnibus or put it there. And I know that it positions us differently either way, but I think the plan is important. But given that, I'm likely to support the committee recommendation, but still ask for the plan. Thank you.
Any further discussion on the motion? Seeing none, Representative Landwehr, you may close.
Thank you, Mr. Chairman, and I understand the concerns and the angst, and I think that things are a lot further along than what has probably been presented to all of the legislators, because the Mental Health Coalition in Sedgwick County actually has a much more detailed plan of mental health in general. Several years ago, Sheriff Easter went around and was finding out who were all the organizations that provided mental health services or substance abuse. They're scattered, they're fragmented. So they've been working to bring those all together. They are looking at trying to figure out how to make a corridor so that we can get more of those services kind of where the need is actually at, which would be more closer into our downtown area. The hospital is a little bit tougher one. And it's not for lack of effort or trying on details, it's finding that location. At one point, we thought that KU Med may be making a move, and that used to be a hospital, and that might be an easier ask for us to do as far as being able to remodel it, because as you know, going through this process, these aren't just beds, these aren't just rooms. A lot of them are what we refer to as blow mold rooms, because you've got to watch for ligature points, the types of furniture you put in, how you mount your doors, what handles you use, etc. I think that this here sends a notice. I did have discussions with the county manager and a couple of our county commissioners here about 4 weeks ago, and I said, I'm tired of waiting. Let's get a plan, because you guys are going to lose this whole idea if someone else comes up with a location. I know that the hospital in Halstead has been talked about, and the only reason that that one hasn't been taken as seriously in the Sedgwick County area is because it's not going to be close to the other services that these individuals will need. Not that Halstead's that big of a drive. We used to do it. In fact, the Halstead Hospital used to be considered the Mayo Clinic in the Midwest when it was open. That's how good it was. I would like for us to send this loud message, this loud discussion that we've had here today back to my community and say, this is where they're at. So what can you bring us? What can you provide us by omnibus? I understand what the intent was of the chairman here, and I'm not saying that he was totally wrong. But let's put it off omnibus and then let's yank it then. But we give them one more shot. So that's why I would ask you to support the motion, and I close.
All right, committee, you've heard the motion. All those in favor of the motion say aye.
Aye.
Opposed? No. The noes appear to have it.
Division.
Division has been called. All those in favor of the motion, raise your right hand.
Say, don't raise your hand, you were a no.
I know, I got to outraise my hand.
I think maybe we'll provide a little carrot to dangle out there.
That's what I'm hoping.
I don't think we're going to get what we need.
Opposed, same sign.
Maybe it's a little carrot to dangle.
All right, the motion passes 13 to 8. We're back on the budget for 2023. Any further discussion? Seeing none, Chairman Carpenter.
Yes.
Representative Helgerson.
That's fine. I'll pass this some other time.
All right. Chairman Carpenter.
Thank you, Mr. Chair. In response to Representative Williams' questions, if we had about the day, I would like to go through this entire budget and provide every bit of information and answers that the entire committee wants. I have all of this information on nursing facilities. I have all this information on mental health beds and foster care. And I have KDAD's recs, and then on top, I have the other deal on the waiver situation. So I understand her frustration. I get frustrated myself because I don't get to really dive into some of the things I wanted to talk about. I wanted to talk about SNAP. I wanted to talk about the Senior Care Act and Meals on Wheels. There's just a ton of things that we don't get time. I want to talk about 988. I wanted to talk about PRTF beds and how we have 464 beds, but 147 of them are vacant because we can't staff them. I mean, there's all those things. So for that, it's part of the process, but I am disappointed, much like you are, with the process. But with that, I move the 2022 and 2023 budgets for the Kansas Department of Aging and Disabilities.
As amended.
As amended.
All right, committee, you've heard the motion by Chairman Carpenter, seconded by Representative Ballard. All those in favor of the motion say aye. Aye. Opposed? No. The ayes appear to have it. The ayes do have it. Motion passes. Thank you, Chairman Carpenter. We'll go ahead. Representative Helgerson would like to be recorded as a no vote in the minutes. All right, Representative Landwehr.
Mr. Chairman, if it'd be all right, I believe that the Secretary of KDADS can also provide this committee that will enhance what was handed out earlier and actually show maps of where all these different types of beds are in our states. And it gives them a much easier visual than trying to, if you're geographically challenged a little bit like I am, it gives you a better idea of where these beds are located and what types of beds that they are.
And we can have that information provided prior to omnibus.
Yeah, she's got them now with her.
Chairperson Williams.
Thank you, Mr. Chair, and I will be very brief. Rather than go over the contents of the report out from Kansas State Department of Education and the budget that is in front of you of $6.5 billion, our committee has made recommendation to remove the budget from our mega budget. You can see the recommendation for 2022. The House Budget Committee deleting $378.1 million, including the FTE. That's for 2022. And if you turn to the 2023 budget at the very end, it also deletes $6.4 billion, including $4.2 billion SGF and the FTE, as well as delete $2.6 billion for state foundation aid that would be in the 2024 supplemental budget. That is to continue putting the education funding with policy, and so that is both the recommendation and my motion.
Any questions in regards to the report out from K through 12? Representative Wolfmore.
Thank you very much. So just to clarify, this budget won't come before us in the Appropriations Committee?
That is correct.
Thank you.
Any other further questions for Chairperson Williams? All right, I believe you also stated a motion in regards to that. Is there a second in regards to the motion? Representative Estes has seconded it. All those in favor of the motion say aye. Aye. Opposed? No. The ayes appear to have it. The ayes do have it. Motion passes. I do want to say that I wanted to go ahead and move the K through 12 education, the Department of Education budget to today so we could have that discussion due to the fact that overnight tonight and possibly tomorrow morning we're going to be having a snowstorm that's going to be coming through. And so we will not be having a meeting tomorrow. So I wanted to expedite the discussion so we could have all the budget recommendations reported out today. So in the event that we do have inclement weather tomorrow, we will not have committee. So the next meeting that we have scheduled will be 9 a.m. on Tuesday. So until then, we are adjourned.